1 in 5 adults in the United States live with chronic pain, according to the Center for Disease Control. And with the rise of the opioid epidemic, many are turning to holistic treatments to manage their often debilitating pain. ABC's Marcy Gonzalez takes a look at some of the options offering alternative to potentially dangerous medications.
Megan Fulmer is one of the 50 million Americans suffering from chronic pain, hers stemming from injuries sustained during her successful career as a dancer.
I just feel a lot of tension all the time. It feels like my body's in this locked, anxious position.
She, like most patients, wanted to find relief that didn't involve powerful painkillers. The Mayo Clinic finding 94% of post-surgery patients surveyed said they'd prefer an alternative treatment over taking opioids. The top concern, addiction, with drug overdoses claiming more than 70,000 lives in the U.S. in 2017.
If there is anything good about this epidemic, it has brought attention to the fact that we need other alternatives for pain management.
And there's now an ever-growing list of alternative treatments, from diet to acupuncture, even yoga and meditation, as well as procedures like the one Fulmer's undergoing called a medial branch block.
Medication's going in.
Her doctor at Mount Sinai Hospital in New York says the injections have been used for other ailments, including lower back pain, but are now revolutionizing the treatment of chronic headaches, with results that can last for several weeks.
You have immediate relief.
Yes.
Move your neck around, see how you feel.
I can actually move it each way without feeling any sort of pinching.
But despite the availability of alternative treatments and an interest expressed by patients, the Mayo Clinic finding that only a quarter of post-surgery patients surveyed actually talked to their doctors about drug-free pain treatments, a conversation experts are urging healthcare providers and patients to have.
Patients may feel like they don't have any other options, and there are both Eastern and Western, or a combination of the two, that can be more effective than simply popping a pill, and safer too.
Offering a chance at what Fulmer describes as life-changing results.
It just feels like I can be a normal human again.
Marcy Gonzalez, ABC News, Los Angeles.